Just a few yards from Birmingham's glittering Christmas market, Peter Crickant lost years of his life to this dingy alley.
I mean, it does. Obviously, I used to come around here every day and inject drugs.
Drugs policies come and go. Peter's seen them all.
It's needle packaging and discarded spoon as well.
As a former user, as a former frontline drugs worker, and now policy reform campaigner. Peter says despite the rhetoric, today's announcement just doesn't deal with the fundamental problem. Drugs are big business, and drug users are still pushed into criminality.
The fundamental changes that I would look for within our drug treatment system is to decriminalise and also to offer real safe support for people in the form of safer consumption facilities, in the form of heroin-assisted treatment, and in the form of non-coerced opiate substitute prescribing, where people are encouraged to stay stable.
Guilt-tripping partygoers won't, warns Peter, reduce demand for drugs, won't help reduce crime, though promises to fund drug treatment and diversion schemes are desperately, life-savingly overdue. People are dying, and Peter would know. He used to run the UK's only safe injecting site, this van in Glasgow.
We would see reductions in harms, people that were injecting in their groin, which is the most dangerous place to inject, in the back of the ambulance where we had good lighting and heating. They'd be moving to injecting in their arms, which is basic harm reduction. People were also asking where they could get support and help.
The Tories see it differently. Tough on crime plays well, as it always has. The Prime Minister speaking from a raid earlier today.
We want everybody to be able to grow up in safer streets, everybody to have the right to have a safe community to grow up in, and too many people have their lives blighted by these county lines gangs. So you've got to do two things at once. You've got to be tougher on the county lines gangs. You've got to be tougher on the criminals who are doing it, but you've also got to make sure that you find those 300,000 people and you help them away.
But over the last decade, while treatment and addiction funding plunged, deaths soared. With hundreds of millions pledged today as part of a 10-year strategy, Labour questioned the detail, but they too are wary of decriminalisation.
The question for the government is not just over the plans today, but the money that they've taken out of the system. Millions and millions of pounds have been taken out of the system over the years, and that has caused a lot of the problems.
But the big picture is this. Can the war on drugs in its various guises ever actually be won when there's billions to be made by organised crime? Regulating the entire global drugs market may not be as complicated as we think, argue some. Just look at the legal production of medical cocaine, for example.
But if we're serious about dealing with drug-related crime and the crime associated with illegal markets, we need to accept that those markets are going to be there either way. Either they're regulated by responsible government agencies, or we default control to organised crime groups and unregulated street dealers.
A revolutionary approach to tackling Britain's drug problem wouldn't just require a linked-up policy across the UK. It would require a global policy to what is a global problem.
Well, I've been speaking with Dame Carol Black, who led the government-commissioned review of drugs policy. I asked her first if the key is decriminalisation and treating drugs as a chronic health condition is the right one.
Well, I think you can start right now without changing the law to treat people as if they have a health condition, because there's nothing to stop us extending to somebody who's drug dependent the same type of services that we offer to someone with diabetes. So I think we should start right now taking that approach, and you can go an awfully long way with it. I have to say I was quite relieved when I was given this brief that I didn't have to contend with legalisation or decriminalisation, because I felt it would distract from what is the immediate problem of really getting much better treatment and recovery started. And you can do that well within the law.
Now, I mean, your experience has been relatively holistic in the way in which you have dealt with effectively drug addicts. And your solutions are kind of things like housing, employment and rehab.
They are, and I think people often get amazed and think, what on earth has that got to do with treatment? But if you want to give a drug-dependent person a fair chance of moving to recovery, at the beginning, you definitely need the medical input, the clinical input, but then you must have very good mental health and trauma-informed services. You do need to have services that will enable someone to live in a safe place. Because if you house a drug-dependent person in a house with other people shooting heroin, they'll go back and shoot heroin. Or if they have to sleep on the sofa of a friend who's still addicted, to really solve this problem, you need 6 departments of state to work together and to be held with their feet to the fire to deliver that holistic message.
But one of the agencies that surely has to be involved is law and order. I mean, the fact is that there are civilians who don't take drugs who are suffering quite considerably from robbery and God knows what as a result of people robbing for drugs.
Indeed, but the research shows quite clearly that if you get such people into high quality treatment and recovery, they stop committing crimes, they stop requiring prison places. So treatment and recovery is not a soft option. It is an option which will do a great deal to reduce the crime in our society.
But then
and we've never really...
in practical terms, would that mean that a court could say, this individual requires rehabilitation, please go about it?
They could, but they would need, what we've recommended in the review is that courts consider many more diversions into treatment and recovery, of course, based on an appropriate assessment, which would be available in the court. But to do that, we needed the resources to make that treatment available. And today, the press release, as you know, has just been released, and we've got 780 million.
Yes, that's a lot of money, isn't it? But then on the other hand, the cost of drug addiction and drug misbehaviour is very much more than that.
19.2 billion a year is the cost to the country of dealing with drug addiction.
Thanks a lot.
Thank you.
Well, a short time ago, I spoke to the Minister for Crime and Policing, Kit Malthouse, and I started by asking him whether the extra spending on rehabilitation and treatment exceeded the budget cuts in those areas since the Conservatives came to power in 2010.
Well, certainly the money being spent on healthcare and rehabilitation will be the largest expansion of that spending ever. We recognise that alongside the work we've been doing on enforcement, and we'll be ramping that up as well, we do need now to get in amongst those particularly heroin and crack users who are driving so much acquisitive crime and deal with their addiction as well as their criminality. And so this big expansion spending on treatment should, we hope, make a difference over the next 3 or 4 years.
But does that expansion make up for the cuts? And if so, were the cuts then a mistake?
Well, as I say, 12 years ago, the government was facing a difficult financial situation. I get asked this question a lot. And obviously, we had to cut our cloth accordingly at the time. Over the first few years of that decade, obviously, drug consumption in the UK fell. That industry then reacted by, as any business would, if you like, by creating new markets, finding new products, making them cheaper. We became concerned about that.
When you look at the scale of the problem, over 4,500 deaths in England and Wales, at its highest level. Is that a public health emergency in your view?
In parts of the United Kingdom, I do think we're facing numbers that are of an emergency scale. In Scotland, for example, and the Scottish Government has responded to that. We met together with the Scottish Government and the Welsh and the Northern Irish just a couple of months ago in Belfast.
The strategy talks about addiction being a chronic health condition. I wonder if it is primarily that you're concerned with rather than a criminal justice crisis.
No, it's both. We want to be unrelenting in our focus on confronting those people who traffic and supply drugs. We've had big success, 1,500 lines closed down now, 7,500 arrests. Importantly, 4,000 young and vulnerable people safeguarded, rescued, if you like, from the grip of these drugs gangs.
So if public health is, you're looking at it through that prism in part, I wonder what you made of the Health and Social Care Committee report a couple of years ago now, saying that they recommended you consult on decriminalising drug possession for personal use because of viewing it in that context. Have you ever considered that?
So we've looked at decriminalisation across the world, and the experience has been mixed in some parts of the world. If you look at California, for example, the decriminalisation of cannabis has widely accepted to have been a disaster. In Portugal, which everybody points to, there was decriminalisation, but also a significant increase in health spending, which is what drove the deaths down. But they've seen a rise in consumption. We don't think decriminalisation is suitable or appropriate or the right thing to do in this country.
You've made clear also you want to target middle-class drug users, recreational drug users, taking their passports away, their driving licences away and so on. Are you worried that you might be passing laws that some of your cabinet colleagues even might have broken?
No, we want to make sure that everybody who is taking drugs illegally understands the consequences of what they're doing, and that this is not a victimless crime, and that those people who are taking drugs, whatever it might be, casually without thought, need to recognize that to get the drugs from where they're produced into their homes is involving an awful lot of misery, degradation, and victimization on the way, not just in this country, but internationally too.
Do you think some of your colleagues in Cabinet, though, were aware of the misery they were causing down the line when they took drugs?
You'd have to ask them, Kathy. I mean, all parts of society are subject to the vagaries of drug abuse.
You've never taken any sort of drugs yourself?
No.
Not even a student spliff?
I'm afraid not, Kathy.
Kit Malthouse, thanks very much.
Thanks a lot.